Welcome back to our diabetes self-management class, and today we're going to focus specifically on exercise. Just a little bit of review. Diabetes is controlled by three main things. We've already talked about some of them already. So we've got nutrition, we've got medications, and then the big one that we're going to focus on right now, exercise. So there's three pillars to this diabetes self-management. So how does exercise affect your blood glucose numbers? So I think the important thing here is to think about what happens in the body of somebody who doesn't have diabetes. So when you start to move, the liver is going to mobilize fuel for those activities, and it's going to release free fatty acids out of the adipose tissue, aka fat tissue. And then it's going to increase glucose uptake by those muscles. That's going to be needing them for the exercise, right? And then there's going to be a decrease in insulin release from those beta cells. So remember, that's where that insulin is released from. In this way, there's a perfect balance between hormones that are both raising the blood sugar and then insulin, which is lowering that blood sugar. In diabetics, exercise can help to lower the blood glucose because exercise lowers insulin resistance, and the contracting muscle helps to pull in and clear that glucose. So a type 2 who is not at risk for diabetic ketoacidosis, remember the DKA, we covered that before, may go out and exercise regularly. Exercise also helps with weight management. It can improve lipid levels. It helps to raise that HDL, which is that good cholesterol, and lower the LDL, which is the bad cholesterol. And it also helps to improve triglyceride numbers. It can help improve cardiovascular fitness and lower the blood pressure. And lastly, it can help with stress management, which we're going to focus on later. However, caution does need to be used in type 1 diabetics that are at risk for diabetic ketoacidosis, or type 1 diabetics who didn't take their insulin, because you're still going to have that liver mobilizing the fuel and the release of those free fatty acids, but without that insulin, the sugar is unable to get into the cells to be used. So it's just going to keep building up and building up, could potentially lead to a damaging situation. In that case, the fats are not absorbed properly, and then ketones are produced. If you remember from our previous section, if the blood glucose levels are above 300, you're going to want to check for those ketones, and you're going to want to avoid exercising if ketones are present. But again, refer back to our previous session where we talked about that specifically in Diabetes 101. So what is the biggest difference you can make to your health? So this is a little bit of a tricky question because there are some overlapping factors here, but let's take a look at some of that research. So in one study with patients that had knee arthritis, they did 1 hour of this specific treatment 3 times a week, and it reduced their rates of pain and disability by 47%. In another study, there was patients that had dementia and Alzheimer's, and this treatment reduced that progression by 50%. There was another study of people at risk for diabetes, and along with other lifestyle interventions, it reduced the progression to diabetes by 58%. And then lastly, there was another study that followed 10,000 Harvard alumni for 12 years, and those that had this specific intervention lowered their risk of death by 23%. It's the #1 treatment for fatigue, and it has been shown over and over again to improve quality of life. Okay, so what is this magical exercise medication? It was walking. Nothing like a triathlon or anything, just plain walking. And you can figure out a way of getting this in, maybe walking your dog, taking a walk break at work. So if you think about this in reverse, there's a lot of folks that do not do any type of activity. And in this one study in Australia, it looked at people that had a sedentary lifestyle versus people who did not. And the persons who had a sedentary lifestyle were expected to live about 5 years less than their counterparts. And in that study, it was about 6 hours a day that they were sedentary and watching screen time. And you may be thinking to yourself, who on earth watches screen time, watches a TV for 6 hours a day? Well, turns out on average, Americans watch 5 hours of television or screen time a day. So it's not hard to get that in. But what's a good question to ask yourself is, can you limit that sedentary lifestyle to just 23.5 hours a day, because the recommendation is a mere 30 minutes a day of exercise. What type of exercise are we talking about here? The recommendation is 5 days per week, 30 minutes of cardiovascular / aerobic exercise. That's going to strengthen your heart and your lungs. And that's doing things like going on a treadmill, going on a walk, doing the elliptical, doing a variety of exercise motions that are really getting that heart pumping. And then there's 2 days a week that we recommend getting strength training in. And strength training is important because we do lose muscle with age, and as we age, we lose our muscle. And you can do this with household objects. I mean, think about lifting cans that are in your pantry for some extra strength training activity. And also, it's important to note that women need strength training too. We typically only associate that with men, but women, it's important for us to get that in as well. And then to get in flexibility when we can. And flexibility helps to improve joint range of motion, increase athletic performance, and decrease risk of injury. The Diabetes Association does recommend not going any longer than 2 days without exercising. But there are some important diabetic complications that you do have to consider when you are planning your exercise. For one, if you've got peripheral neuropathy, okay, and you cannot feel your extremities, your feet, you might want to limit weight-bearing exercises and repetitive foot motions, so avoid jumping, jogging, pounding, and instead try something like a stationary bike or swimming or perhaps a rowing machine. If you've got retinopathy, diabetic retinopathy, as we've talked about before, the eyes can be severely affected by poorly controlled diabetes. And in that case, you're going to want to, be mindful of any heavy weight bearing or straining. It's putting pressure on that optic nerve. And you're going to want to try low impact aerobics, walking, or swimming. If you've got peripheral vascular disease and you've got a lot of pain in those lower extremities, you're going to want to really try to focus on upper arm exercises, or maybe even chair exercises, or swimming. And of course, if you're at risk for having a cardiac event, you're going to want to get approval from your doctor before you start an exercise regime. So why should you exercise? Okay, so this is a big question. So exercise actually works in the body very similarly to medications. It helps to pull in that glucose into the muscle, into the cells to make it usable. And this is exactly what diabetic medications are doing. Exercise also makes your body more sensitive to insulin. It helps to lower that blood glucose. Short term, it can lower that blood glucose, but on a long-term basis, you're talking about lowering that A1C, which, as you remember, that's the measure of 3 months worth of blood glucose numbers. So it can really help to improve that control. So what are you going to want to do to get prepared? So before you exercise, you're going to want to talk with your doctor and make sure you don't have any restrictions that you may not be aware of. If you're taking insulin, just be mindful that that dose may be affected, so talk to your doctor first. Get prepared, have an emergency fast-acting simple sugar in case you do experience a sugar low. Get hydrated, so have proper water on you, get proper footwear, make a plan and be consistent. That's the key here. If your blood sugar is less than 100, you may need to take a snack first before exercising, because again, exercising is going to lower that blood glucose. The most common side effect of exercise with people with diabetes is experiencing a low. So you just want to make sure that you're in control of that and you're eating something beforehand. If you're a type 1 or type 2 on insulin, I touched on this a little bit earlier, but if your exercising is planned for just before or after a meal, consider decreasing that short-acting insulin that covers for the meal. Again, talk with your doctor before you do this. If exercising is planned for 3 to 4 hours after a meal, you may need to add a snack before you exercise, okay? Because it's been a little while since you've had some carbs. If you're on a pump, you may need to consider decreasing that, temporarily decreasing at least that basal insulin. And you may have a different carb to insulin ratio on the days that you're exercising. Again, talk with your doctor first before making any changes, but these are all things to consider. So when should you exercise? So typically you're going to want to exercise whenever your blood sugar numbers have a tendency to be really high, right? So that's right after you eat. So like 1 to 2 hours after you're eating a meal is when those postprandial blood glucose numbers are at their highest. And that's when you should try to plan to exercise. However, if you can fit it in realistically, fit it in whenever you can. These are just ideal numbers. So what is needed? Okay, so you've made this plan, now you need to actually put this plan into action. What do you need? So you need your meter, okay? So you're gonna need your meter because you need to be able to check your blood sugar. You need quick acting simple sugars. We've talked about, like a packet of jelly, for instance, that's about 15 grams. Glucose tablets, now be mindful those glucose tablets are only 5 grams of sugar each. So you're gonna need a couple of those, 3 to 4, to have that 15 grams of carbs that we've talked about. You're also gonna need a medical ID, just in case something happens. People need to be able to know that you are a diabetic. So a lot of people wear like a bracelet or something to identify they are a diabetic if they have diabetes. Have plenty of water on you, good shoes, good socks, and then you're ready to go. So how does exercise actually fit into your plan? How does it fit into your way of life? And we've talked about in this class how important exercise can be. But if it is so important, then why does it tend to be the first thing that we give up whenever we have a lot going on? So we need to think about what's going to motivate us and what's going to keep us in that plan. What's going to keep us exercising? What's going to get us exercising in the first place, right? It's important to know that 30 minutes that I talked about a day, that can be broken up. So that can be in 3 10-minute segments. It can be in 2 15-minute segments. As long as you're getting that in, you can break it up. Another thing is getting an animal, getting a dog. Actually, getting a dog has been shown to help people attain that goal. People who have a dog are more likely to exercise than people who don't. If you don't have a dog, some of my patients have walked their cat on a leash. I don't think my cat would go for it, but you could try that as well, just to get that cat out there and get them on for a good little walk. But people who have animals generally do exercise more than those who don't. Schedule a workout with friends. So this social atmosphere of exercise can be really beneficial for some. Other people, they want to be able to do it in the privacy of their own living room, so you can put on some YouTube videos and find some exercises on there to help you get that exercise in. Think about your commute. So if you are taking a bus to wherever you need to go, get off a stop earlier, park farther away, take the stairs instead of the elevator. So these are some simple tips just to get those steps in, getting more movement in. And then thinking about movement in a way where it's not even exercise. Some people really like dancing, so dancing is also exercise. Really anything that's moving your body, okay? So, and that can be a fun thing too. But think about a way for yourself to be able to get that movement in. The next thing we're gonna talk about is stress, and how does stress affect diabetes? So we've already talked about medications, we've talked about exercise and nutrition. Now those are the 3 main ways to affect your diabetes and to lower those blood glucose numbers, but stress management also plays a role. So what is stress? Stress is defined as our body's physical, mental, and emotional response to an event that may cause fear, anxiety, tension, or pain. Now, this served us well whenever we were, running around cavemen and we were getting attacked by animals or attacked by neighboring tribes. But now we have this fight or flight response that doesn't tend to turn off because there are so many outside stressors in our 21st century world. So stress raises hormones in our body that act like gum. And what I mean by that is, if you remember us talking about how insulin works. So insulin is unlocking, it's that key that's unlocking the lock. Remember? So imagine a big wad of gum on that lock, and that key cannot open the lock no matter how hard it tries to unlock it. So that's how stress plays a role in that blood sugar management. So how does stress affect your diabetes, and how does having diabetes affect my stress? Well, if you think about it, having diabetes can be very stressful. If you're thinking about, you can't eat this, you can't eat that, did you check your blood sugar? Do you have your supplies? Are you going to the doctor? Are you getting those prescription filled? Have you taken your insulin? Are you taking your medications? Are you taking your medications with food? There's tons of things that go through the mind of people with diabetes all the time. 75 to 90% of doctor visits are related to stress. and the problems with chronic stress. So stress in the body makes that body more resistant to insulin. So it's not going to respond to the insulin the way that it needs to. And it also connects to high blood pressure, heart disease, and weight gain. So it's important to find what works for you to help to cope with your stress. If we're brainstorming those ideas, some people have stress relief by exercise, and it has been shown to do that. Some people get stress relief by talking with others and having that social network of friends and family to talk to and to vent to. Some people have it by practicing deep breathing or prayer, meditation, practicing healthy habits, eating healthy, sleeping regularly, journaling, listening to music. There are all kinds of ways of getting that stress management into just relax. I know for myself, if I come home from a long, stressful day of work, I really want to take a long hot bath and light some candles and listen to some Enya. But that may be what works for you, but just brainstorm what's going to work in your life and what's going to help you to maintain those stress management levels. Let's review again. So diabetes is managed by what three main things? We've got medications, we've got exercise, and nutrition, right? We've learned that in all of our sections. And we need to know what our blood sugar targets are. So for our fasting, we have 80 to 140 is what we should be. That's what our goal is. And if it's after we've eaten, it is 140 to 180. That's usually 2 hours or less after we've eaten. And we also need to know how to make a goal, SMART goals. So if you want to lower your blood glucose, that's not very specific. We want to do a SMART goal. SMART is specific, measurable, action-related, realistic, and timely. So we want to add all those aspects to our goals. So I want to lower my blood glucose in 1 month by exercising for 30 minutes, 5 days a week. That's getting really close, right? So we've added a time measure. In 1 month, that's the time, and we've made it specific and measurable by saying 30 minutes, 5 days a week. It's very specific, that's very manageable. Now, is that realistic? Maybe not so much. You could do 3 days a week, would be a little bit more of a realistic goal until you can work up to that 5 days a week. And then adding another aspect, maybe a location, to make it a little bit more specific. So we're gonna say, I wanna lower my blood glucose by exercising 30 minutes, 5 days a week after dinner. So that's an example of a SMART goal. So think about it for yourself for a minute before moving on to the next slide. What's going to be your SMART goal? Now I'm going to want you to think about all the things that we just talked about. So both with exercise, think about SMART goals for your exercise. Think about SMART goals even for your stress management. And how are you going to implement these in your life to get better control of your diabetes? And let's move on to the next section where we can learn about nutrition.